Good morning. I am Miss Wright, and today we'll be going over the order of draw. All right, so we know we're in phlebotomy. It's all about drawing blood the proper way, making sure you know what tests the doctor wants and what tubes they go into, how they need to be transported from beginning to end so that you have the best possible sample. The order of draw can be a little overwhelming because there are a lot of different tubes. There are your standard tubes that you draw from, and then there are a lot of different tubes that kind of come in. Not to worry, most of the time, no matter whether you're in a laboratory, a hospital setting, or a doctor's office, you will have instructions on whether the specimen needs to be refrigerated, freezed, whether it's a stats specimen that needs to go out immediately, whether that specimen needs to be spun down in what we call a centrifuge, which separates serum from plasma. There's a lot. So we're just going to take it slow and we're going to talk about just the order in which the tubes go in, okay? I don't have any tubes. I have a little chart that gives you color codes and then lets you know what's in each tube and some of what each tube does. And then we'll talk about the additives that are put in some tubes and what the purpose is. And the biggest reason for the order of draw is because you're using a vacuum tube that has stuff in it and a puncture that goes in from the needle holder to allow the blood to pass through. Each time you use a different tube, you can pick up additives. So some additives are okay to maybe be mixed in, some additives are not, which is the reason why you have things that need to be drawn first to keep it as pure as possible to the last where it's okay because what they're testing for won't be interrupted. All right, so first things first, in the order of draw, typically done in labs and or hospitals would be blood cultures. Okay, they do not look like the typical vacuum tube. I don't know whether you can see that or not, but that is a blood culture. That is always done first. And typically you might need to draw a blood culture, one from each arm, because they're looking for viruses and bacteria that can be in the blood. And you might use a different thing to get any other test. It depends on the protocol of that set lab, okay? But in any case, it's always blood cultures first. All right, after that, that's going to be a lavender top tube. I'm sorry, a light blue type tube. L's. The L's throw you off. I do have a little acronym that I'm going to share, but next would be light blue. Light blue has a sodium citrate in it that helps to keep the blood from coagulating, and that test is very popular with patients who are on blood thinners. So you'll see if your doctor's ordering a PT or a PTT, which is prothrombin, which you'll get to. I promise you'll get it. If you're in that lab setting, those tests will come to you like this. But if you see a doctor ordering a PT or a PTT, they're looking to see how fast your blood clots. So the additive in there helps with that, and you would draw that light blue tube first. Anytime you have a plethora of tests, if there's a PTT, that tube would go first, okay? So after your light blue, then there's red. The red top is a plain tube, red vacuum top, and that is for pretty much like whole blood. The blood will coagulate in the red top tube. With the red top tube, all of them get inverted, with the exception of the blood cultures. All of the tubes get inverted, okay? And when we talk about inverted, if this was your tube, you would take it and pretty much take the tube into a figure 8, okay? And this is literally before you sit it down once you pull it out of the patient's arm. So all tubes must be inverted. You take them out, you invert, you place them, you pick up your next tube, and you go. So we're talking multiple sticks, but no matter what, you invert that tube before you put it down. Typically, you'll see it say 5 to 6 times. Some of them say 8 to 10 times. It will vary, okay? After you draw a light blue tube, and then you draw a red tube, which again, you'll see blood start to clot in that tube and separate on its own. The next would be gold. Now, gold is a newer, more recent tube in the last decade or so, because it's typically a serum separator tube. It's been known as a tiger top tube, red and gray. Now the most popular one is gold, but they all do the same thing. They literally separate. It's called a serum separator tube. It has a clot activator inside, and it separates blood from plasma. That tube goes in the centrifuge. In the centrifuge, it spins the tubes around very quickly, and when it comes out, you'll see the serum on top, plasma on the bottom. Serum will look like oil, like olive oil or apple juice, if you will. If the patient is fairly healthy, I have seen some serum spun down that looked like chocolate milk, which kind of indicated that they had high cholesterol. So popular test with a serum separator tube would be your chemistry. So your basic cholesterol, your liver function, kidney function tests and things of that nature, a little bit of your sugar, your creatinine level. So these are basic tests that you'll see done typically at physicals or in any specialty. So far we have blood cultures, we have light blue, we have that red, and then we have that serum separator, i.e. gold, tiger top, okay? Next, you have your greens. Greens are typically done hospital urgent care settings. You have a light green and a dark green. They have a lithium, heparin, sodium additive going on. Looking for kind of like ammonia, if you will, in the blood. And it's pretty much the plasma, when the plasma needs to be tested. After your greens, you would have your lavender, another very popular tube. Your lavender has an EDTA additive in it, anticoagulant agent, and that's where you're going to get your whole blood, your plasma, your everything. It's looking for the most popular test is CBC, which is the complete blood count, hemoglobin A1C, which is tested every 3 months in diabetic patients, and sometimes at a physical just to make sure your overall sugar is doing good. And I'll give you a little tip. CBC and chemistry testing are the most popular tests done, especially for a primary care office, period. So you'll see a lot of gold and lavender tops go together. Those are at least the two tops that you'll typically see being drawn. All of the blood, basically, it just makes sense to try to fill each tube up, I'm sorry. Okay, so after the lavender, we get into your gray. Gray is typically done for a glucose tolerance test. Let me see. The gray has a sodium fluoride in it, but anytime you need to check a sugar over time or GTT, you would use that gray. And then sometimes you will see that yellow. Yellow top tube checks for cultures as well. Any type of bacteria, DNA testing for a yellow top tube. Let me see what else. Maybe some of the HIV tests in the yellow top tube. So honestly, when you get into different specialties, you'll definitely see different tubes. And of course, if you work in a lab, you're going to see them all. You're going to see culture tubes. You're going to see tubes for specimen collection. But knowing the order of draw is very important. All right. So in that order of draw, understanding one, tubes have an additive in it, and it needs to be mixed properly so that the test does not give any false positive or false negative or wrong readings. Again, take that. It's no shaking, because you could damage and cause red blood cells to show up where it's not an overproduction. You want to definitely take your tube, invert it as such, place it down, continue going. Once you draw that blood, you will always need to know what needs to be refrigerated, what needs to be frozen, what needs to go out with an ice pack, what needs to sit in order to coagulate properly. So there's a few tubes that need to kind of sit to be coagulated. The tubes that you centrifuge, I talked about a centrifuge, and that would be anyone with a gel clot activator. Okay, so that gel clot, as it's spinning down, will move up. It'll separate that way that it could be tested the proper way. Okay, so most popular tubes, you have your blood cultures, your light blue, your red, your gold or serum separator, your greens. You got light green, dark green, and then you have lavender. After your lavender, you have gray, and then you have yellow. One fun acronym for that. Boys love ravishing girls like dieters love Greek yogurt. If you can remember that boys love ravishing girls like dieters love Greek yogurt being one of those non-fat yogurts, might be a good way to help you remember blood cultures. Light blue, red, gold. Gold is always serum separated though, okay? Light green, dark green, lavender, gray, yellow. Those acronyms. It comes with much studying, much looking. I kind of color coded, so you could definitely use a lot of different things for your study guide. Use that acronym as we become familiar with the order in which we draw blood. Blood is drawn in that antecubital space, usually using that good old median cephalic vein. Another important thing when we talk about additives and making sure we're not mixing, your site should always be used to clean with alcohol versus any type of other cleaning agent. Because alcohol is known to not go through or mess up the test, whereas betadine solutions can have an issue depending on what tube you're drawing. I'm open for any questions, and let's talk about the order of draw.